So this is my algorithm that I actually have created especially for this course, and this algorithm is dealing with the topic of dysphagia, and we are going to go through it in extreme detail. So the first thing I want to mention is that we're going to be starting on this side of the algorithm. So the first thing we're going to discuss is oropharyngeal dysphagia, which is one of the two big types of dysphagia. The other one is esophageal. So let's start with oropharyngeal dysphagia. So oropharyngeal dysphagia is also called transfer dysphagia. It's a clinical condition caused by swallowing problems occurring in the mouth and or the throat. It can be both due to structural or neurologic abnormalities. Its most common etiology is neurologic dysfunction secondary to underlying cranial nerve disease after a stroke. Other neurologic causes include Parkinson's disease, ALS, multiple sclerosis, Alzheimer's disease, poliomyelitis, or post-polio syndrome. The most common structural cause is Zenker's diverticulum, and most common complications include aspiration pneumonia and weight loss. And basically aspiration pneumonia because food is going down the wrong pipe. Patient cannot swallow properly, and the food, rather than going in the esophagus, is going into the trachea and into the lungs. So what are the symptoms of oropharyngeal dysphagia? So the symptoms are the patient is going to have trouble moving food to the back of the throat. Patient is going to have coughing, choking, or nasal regurgitation of food, or patient is going to have deglutitive cough, which is patient having cough while eating.